Doctors, what do we terrifyingly still not know about the human body? I'm an anesthesiologist. We still don't really know why inhaled volatile anesthetics like sevoflurane, the principal anesthetic agent used to maintain general anesthesia, work. We kind of have an idea of maybe how it happens, but we really don't know. It's commonly said in my field that whoever figures this out will win the next Nobel Prize in medicine. Story 2. I'm a sleep specialist. While we do have some good theories about some functions of REM as far as how it affects the brain and health, we still don't fully understand the purpose of dreaming. Like, why do we dream at all, and why do dreams have a narrative instead of random incomprehensible imagery? Unfortunately, this is unlikely to ever be solved. Dreams are the entire reason I took my first year of university in psychology. I thought they were the coolest, most confusing thing ever, and I wanted to learn more about them. Surprise, surprise, you don't learn about that in first year psychology. In fact, I don't even know if psychology is the right field for that. So my exploration was unfruitful, and then I switched majors. But dreams are just super cool, aren't they? Story 3. I have a very niche answer. We don't know what is supposed to naturally bind to the area that benzodiazepines work at. Benzodiazepines, BZD, are medications like Xanax and Valium. They produce anti-anxiety effects, and they have a very distinct chemical shape to fit into the BZD site in a group of 5 proteins. But we don't know what is supposed to go there. Many medications are analogs of naturally binding molecules that we copy and then use to create an effect. The BZD site is for something, we just don't know what. Story 4. Not MD, but PhD. Right now we're working on the connection between our intestinal microbiome and neuropsychiatric disease and brain aging. For instance, people with inflammatory bowel disease are more likely to develop a dementia and experience comorbid anxiety and depression, but we don't know why. Story 5. We don't know the precise mechanism by which B12 deficiency causes a nerve damage. We know it happens, but not why. Many medical things are like that, easily observed and proven cause and effect, but complex and unclear mechanisms. Much of biology is still a black box to us. Neurological stuff in particular is full of this. Lots of, oh, we definitely know damage here causes XYZ, but not Y. Story 6. There are organelles called vaults in human cells, and in most other eukaryotic species. They are made of 78 copies of a protein called the major vault protein, totaling about 3 times the size of a ribosome, and larger than most viruses. Their function is not totally understood, but it's probably something to do with the nucleus, though analogs of the genes for vaults even appear in bacteria. As they're found in such a wide variety of species, life on Earth must have started making vaults early in its life. The similarity of the genes encoding vault proteins across a diverse species would presumably indicate the importance of vaults for viable life. But experiments haven't shown a great deal of harm done to lab animals that had their vault genes knocked out. Even stranger, several of the species used in laboratories as model organisms naturally lack vaults. The use of these organisms long predates the discovery of vaults in 1986, with some going back over a century. Story 7. Doctor here. Off the top of my head, here's a few deceptively big ones. We still aren't exactly sure how anesthesia works. We just know it causes certain effects and they're useful, so we use it. Psychiatry is still shockingly infantile in our understanding of human disorders. It's constantly in a state of flux. We don't understand a lot about the meds we currently use, and the diagnostic criteria for disorders still changes as we realize, hey, maybe all these behaviors aren't the same source disorder. It's incredibly hard to diagnose when the criteria is largely based on self-report and subjective observations. To a lesser degree than number 2, neurology is still learning a lot. It's further because you can observe more objective findings in neuro than psych, but we still struggle a lot with how brains function. Immunology. Don't even ask me. No one really knows. And yawns. Still guessing on why that happens too. There are some theories, but that's the best we got. I thought we did know why yawns were a thing. Or at least, I was told a reason. Admittedly not in school or anything, I don't think, but I thought it was your body being like, I need more oxygen for whatever reason. And so it sort of forces your body to do this big, like, gasping breath thing. Although, I don't know, now that I'm saying it, it sounds kind of weird, so I guess not. That's what I was told, though. Did anyone else think that, or is it just me? Story 8. For many medicines, it's not clear how they work, or even if they work. For example, look at the actual efficacy trials of name-brand antidepressants. When you look at them in aggregate, they look like they barely work. Yet basically everybody knows somebody whose life was saved by a specific antidepressant. Story 8. Apparently we know next to nothing about fibroids, which like 75% of women have at some point in their lives. That's great considering that the largest one removed was 100 pounds, so not exactly a minor issue. There are theories about different hormones and what things put you at higher risk, but aside from having surgery to have your existing one removed, there's basically no information on what you can do to prevent them from coming back. Story 9. One thing I haven't seen mentioned, we apparently don't know precisely how our bodies can distinguish gas from poop. We have some ideas. We know there are a ton of nerve endings in the area, but the precise mechanism of our bodies telling our brains, "This is a fart, let loose," isn't really understood. What blows my mind is it's distinct enough that we even pass gas while asleep. That difference must be wired deep. Story 9. I'm a nurse, not a doctor, but in school I learned that when in vitro fertilization was being pioneered, scientists were unable to create an embryo from the combination of sperm and egg. It wasn't until they added female secretions in that they were able to produce viable embryos, and they don't know what role those secretions play in the process. This was about 15 years ago, though, so if anyone has new information on the topic, I would love to hear it. Story 10. Had a pathologist tell me that the interesting part of his job wasn't finding out how someone died, it was seeing everything that can be wrong with someone, so many life-threatening or life-altering horrible things that a person can have going on and still be alive. Good friend died of pneumonia. He was too busy at work, couldn't afford to take time off. He kept using OTC meds for the symptoms. He died unattended, so the coroner had to get involved and they did an autopsy. His body had cancer in 3 different places. He never stopped. Dude was old-time tough. Story 11. It's not cancer. It's cancers, and every specialized and stem cell, undifferentiated pluripotent cell, is at risk of mutating into something that doesn't stop multiplying. The cancer of a specialized gland cell is called adenocarcinoma. The cancer of a skin cell is called squamous cell carcinoma. The cancer of a melanocyte is melanoma, and so on. So anytime someone says, they're hiding the cure for cancer, they're being magnificently ignorant. Story 12. Not a doctor, but the amount of shrugs I got from doctors when I asked questions during my treatment for breast cancer was astounding. That's not to imply they were useless or didn't know what they were doing, I just asked a lot of questions. Me. Why do I need to take Claritin before chemo? Nurse. It helps with bone pain. Oh, that's interesting. Why is that? Nobody knows. Or me. What's the cording I'm experiencing in my arm following my mastectomy? Physical therapist. Nobody actually knows what it's made of or where it comes from. Or me. Why am I suddenly unable to eat gluten following my cancer treatment? Gastrodoc. Trauma, probably. Having cancer really made it clear to me that so much of the human body is still a mystery. Story 13. How basically any of medical science works in relation to women and their bodies. Almost all the data is based on men, and a lot of it almost exclusively. This drives me crazy. The rules on clinical trials need to change to ensure that both genders are represented in the study findings. Selection criteria is always healthy men and postmenopausal women, when women's hormones have a massive impact on health for most of their lives, and it remains unstudied. Being a woman is difficult when it comes to receiving care. The answer to many ailments is anxiety, depression, and, quote, being a woman, FFS. Viagra is a drug found to significantly improve period pain, an actual thing that most women deal with every month. The research was canned. The drug isn't licensed for women. Meanwhile, men are gifted hard-ons because it was studied widely. Men's intimate pleasure is more important than the pain women face for nearly a quarter of their fertile lives. Story 14. If I'm not mistaken, don't we still not have a definitive cause for migraines? Edit. It took me years to find my trigger. Sleeping on my back, exacerbating my apnea. I would wake up with a raging headache at 4 a.m. and barf 2 to 3 times an hour until 2 p.m., twice a month. I couldn't eat, drink, take a medicine, drive, talk, watch TV, or think. I would spend the day alternating between the bathroom floor or in bed hallucinating from the pain. I got a daith piercing nearly 4 years ago and it changed my whole life. I can count on one hand the number of times a headache has made me barf since getting the piercing. If I wake up with one, I maybe get sick once, take an extra strength Tylenol, and lie down for an hour. And then it's like I never had anything wrong to begin with. Story 15. The uncanny valley fear. Why are humans unnerved and or afraid of things that sound like, mimic, look like, or act like humans but aren't? Think of seeing human-shaped shadows, dolls, robots, animals walking on 2 legs versus their usual 4, AI. It's fascinating how we all have that feeling about some of the same things. Story 16. Not a doctor, but I always find it wild how unsophisticated a lot of surgery is. Like, it is the year 2025 and our best solutions for lots of problems is still just cutting something. Like your hand or wrist hurts? Oh, let's just cut that ligament. Oh, you've got stomach pains? Let's just cut out the gallbladder. It's crazy we still haven't figured out less barbaric solutions to a lot of these problems. Story 17. Unexplained infertility is the actual name of an actual diagnosis given to my wife and I because, according to every test based on what modern medical science knows about fertility, we're fine. We should be able to conceive. All the numbers are right. We probably even would be able to conceive either of us with different partners, but no one knows why the 2 of us together can't. And it happens to far more couples than anyone talks about, but the only diagnosis we all get is unexplained infertility. Story 18. The brain, and especially how it governs our actions and personality. Why do some people commit crimes, like assault and murder, despite knowing the consequences, while others would never do such things? Why do some people require multiple chances for rehabilitation while others live their entire lives right? We don't know the answers. It annoys me to no end when some people chime in and claim, everyone can be rehabilitated, as if we actually know what that even means and how it works. Story 19. I'm not a doctor, but when I found out I was having identical twins, I started looking into the biological process that leads to identical twins. It turns out nobody knows. There's a lot of info on the type of identical twins you'll get depending on when the zygotes split, like whether a placenta is shared, if the sac is shared, or if they're conjoined. But why? There's also significant disagreement in the medical community on whether or not there's a hereditary factor. Feel free to correct me if my info is out of date though, because I looked into this about 5 years ago. Story 20. Obligatory, not a doctor, but a lot of folks don't understand spinal cord stuff. I think people should know spinal cord injuries aren't healed if the patient starts walking again, and that if one happens to you when you're young, it's okay, and you don't have to try to force yourself back to normal. You have a new normal now, and that's fine. Nobody can make your decisions but you. They can shame you, but don't listen to them. Story 21. What causes endometriosis and how do you treat it effectively? The leading theory is retrograde menstruation, which occurs in 80 to 90% of women. I mean, okay. Then why do 80 to 90% of women not have endometriosis? There's clearly something else going on that we don't know. Also, the only way to get rid of or remove endometriosis is through surgery, but there's a high rate of recurrence after surgery anyway. Some women undergo multiple surgeries for it. This seems to link back up to quite a few stories back. Just generally, women's health isn't studied enough. Healthy men seem to be the model for medical science, which, isn't exactly fully representative of people who are not men. So, a lot of them. I don't know a whole ton about endometriosis, obviously, but when I've been talked to about it, it doesn't sound pleasant. And it also sounds super underplayed whenever they talk about going to doctors or whatever, just completely dismissed. Like, oh yeah, that sucks, it'll hurt, sorry. Like, damn, brother, nothing? You can't do anything to help? Story 22. We still don't know what actually causes ADHD, which is why it is not readily accepted as being a real disorder by much of the population, and people think it only affects attention. However, without trying to make this into a lecture and keeping it short, there's a very active part of the brain that does a lot of things. We don't know what those things specifically are, but there are a lot of indicators it does something big. The claustrum. The theory goes, it's the part of the brain responsible for actual consciousness. But back to the ADHD part. 2 to 5% of people have ADHD. If you're on social media, you can tell it's a lot of people. Additionally, the leading causes of death for people with ADHD are taking their own lives and murder. That's right. If you have ADHD, you're more likely to die from taking your own life or from someone taking your life than to live to old age. Yeah, if you have ADHD, you literally have an actual disorder that means you'll either off yourself or someone else will do it, but I digress. What we do know, the claustrum, lights up with greater activity with people who have ADHD. We know when the claustrum is inhibited in rats, they kind of just do whatever. If we one day understand the claustrum better, and it turns out that it's responsible for ADHD, that would mean the general public could finally come to understand, especially the parents of ADHD kids, who are significantly more likely to abuse their ADHD children that they're actually mistreating their kids because of a health issue more closely related to epilepsy rather than just a lack of discipline or behavioral problems. That shift in thinking would literally save lives. I hope the purpose of the claustrum is clearly identified and understood one day. It also might mean people with ADHD may experience human consciousness very differently too, and that's where it gets really interesting. Story 23. I tell my residents that only about 40% of what we do is evidence-based. Much of what we do is based on flimsy evidence or grossly inadequate follow-up. For instance, the longest semaglutide trials are around 2 years. They make it sound longer by reporting the duration in weeks. 104 for Sustain 6 and Step 5. What's the plan for following up to see if these drugs are safe for 5, 10, or more years? There is an encouraging trend toward reviewing established treatments, with a bunch being subject to medical reversals. Think of 3V coronary disease, estrogens, and menopause as the prime examples. This is a roundabout way of saying, we mostly don't know what we think we know about the body. If you want to lose sleep about how fragile we are, consider the basilar artery. This single point of failure to your brainstem is only about 3 millimeters wide, with flows about 150 milliliters a minute. 3 millimeters is a bit over 1/10 of an inch. Also, we have no idea why we sometimes shiver when we finish peeing. That last one feels very unrelated to OP's general doom and gloom vibe in the rest of the post. The whole very serious, medicine is really not as safe as we think it is, or well explored at least as we think it is. And also, why do we shiver when we pee? I don't get it. It's good to know even a doctor has these thoughts. Story 24. I'm a surgeon specialist still in the decades of training, but toward the end. I'm planning to subspecialize in trauma surgery and critical care, so that's where most of my interest is in. Something I'm currently studying is understanding who lives and who dies after major trauma, aka, why are some patients resilient and bounce back, while others never recover or die, even when it's the same injury pattern, severity of injury, age, comorbidities, etc. In the same line of thought, there's a lot of ICU medicine we don't know. Once you're in the ICU, like with trauma or with sepsis, we mostly use supportive care and are behind the ball in treatments, as we don't understand the pathologies well enough to take active or preventative measures. So trauma patients in the ICU are at substantially higher risk of infection, usually ventilator-associated pneumonia, but we don't know why, who is going to get it, and we don't prophylactically treat either. We wait for it to happen. Similarly for trauma, we don't know even the most basic pathways of how the body responds to trauma, or why severe trauma leads to a massive or systemic response while less severe, how is that defined even, leads to a more localized response, to then even figure out which pathways can be targeted to help with recovery. Story 25. Not a doctor, but a patient that has found a couple things with blatantly missing answers. Allergy tests don't tell you what you're allergic to. A prick test can tell you what your skin is allergic to, and a blood test can tell you what your blood is allergic to, but there is no test that can tell you what your stomach or GI tract is allergic to. You can do an elimination diet for an extended period of time to find some answers, but even then, it's not 100% conclusive if a particular food or group of foods causes inflammation or non-life-threatening allergic reactions. I have a condition called costochondritis, where, TLDR, the rib joints lock up. When they come free, it feels like a heart attack, which is also fun with GERD causing similar pains. No one knows why people have it or how they develop it. Maybe it's overexertion. Maybe it's underexertion. Maybe it's pregnancy or breasts or weight or walking too hard. Or maybe you're just unlucky. Despite medical reports showing the vast majority have it for 1 year or more, most doctors don't have any knowledge of it, shrug it off as nothing, and treatment is basically, take a couple Advil, you'll be fine. I'm going on 5 years with it, and I am certainly not fine. Every doctor looks at me crazy. Hell, I spent this weekend in bed because I was having a flare-up and in so much pain. But my heart and lungs and GI check out, so screw me, I guess. I can't speak to OP's own condition, the costochondritis or whatever. I'm pretty sure I pronounced a lot of things in this thread wrong, so sorry. But for the allergy thing, is that correct? To my knowledge of allergies, as someone who has them, that doesn't really make sense. Because allergies are your immune system having a response to things, and your immune system is, I think, in every part of you. Your blood wouldn't have a different immune system than your gut, right? If anything goes wrong in your gut, it wouldn't be an allergy, it would be an intolerance, no? And those are medically distinct, I believe. Anyway, I might be talking out of my butt here, but I think OP missed the mark on that first one. You can let me know if I'm an idiot in the comments. Don't worry, I can take it. Anyway, thank you so much for watching. I hope you have a wonderful day or a night wherever you are, and I will see you in the next one.